Starlight. Hello, thank you for joining me today. Today we're going to talk about hospital-acquired pressure injuries, or HAPIs. And through that, we're going to do the Skin Care Comp Fair 2020. So first I'm going to tell you a little bit about our house-wide HAPI rates. So since August of 19, our HAPIs have steadily increased, as you can see by this graph here. So sadly, despite our other interventions, nothing is really causing a decline in them. Our top 5 locations for HAPIs are on the coccyx, the ear, the heel, the glute, and the lip, which you can see by this top graph. And then the top 5 devices are Optiflow, BiPAP and CPAP, oxygen tubing, ET tubes, and Foley's, which you can see from our bottom graph. So you're probably asking yourself, what is the skincare fair? Why am I here? I'm already annoyed. I'd like to go home. So the skincare fair is actually a hands-on approach at trying to create new, reinforce current knowledge about our hospital-acquired pressure injuries. So this is a pressure ulcer prevention in-service, and we're going to do 8 different booths, and it's going to be hands-on activities, and it'll hopefully reinforce to you the Braden scale and the crucial role that you play in it. So if you don't already know, what is a HAPI? Like I said, it's a hospital-acquired pressure injury. So this is anytime there is prolonged pressure or high pressure for a low amount of time on a certain area on the body. So some common examples are the coccyx, the heels, the nasal bridge, oftentimes from those BiPAP or CPAP masks, ears, a lot of times from Optiflows or nasal cannula, and one that is often forgotten about is the occipital area of the head. This we see in a lot of spinal cord injury patients that can't move their head, or for those patients that are intubated and sedated for an extended period of time. So let's get started with our first station. Okay, so thank you for coming to station number 1. So this station is all about moisture and the effect that that has on the patient's skin. So this first exercise is called the Great Barrier Reef, but we're also going to combine it with another one. Okay, so as you can see, we've applied barrier cream to this patient's left hand, and there is no barrier cream applied to the broken, jankety right hand. So what I'm going to ask my assistant here to do is place the left hand all the way in the water as much as you can and hold it in there, and then the left hand as much as you can, please place your hand in there. So as you can see in the water, we have red food coloring. So the idea is that with the barrier cream applied to this left hand, the red food coloring isn't going to be absorbed by the skin. And this is just to show you how when a patient voids or has a bowel movement or anything of that nature, that the skin does absorb that moisture into the skin, thus creating an increased likelihood for HAPIs. Moisture is a risk factor for developing pressure injury. It's important to use barrier creams, and in our case, a barrier wipe, to protect the skin during incontinent episodes. So while my assistant is still soaking their hands, we're going to also touch on our other station, which is called Gotta Go, Gotta Go, Gotta Go. So we all know that we have those incontinent little old ladies or men with larger prostate, and when they tell you they need to pee, they have to pee, and they mean they needed to pee about 3 minutes ago before they could even find their call light. So again, if you think back to the times where you wash dishes and your hands are submerged in water for an extended period of time, then your fingers start to get a little bit pruny. It's the same instance for our patients when they've peed, and then we have to let them sit in it for a little bit before A, we know about it, or B, we can even get in there to get them cleaned up because we have critical other patients or anything else going on. So moisture from incontinence irritates the skin and contributes to pressure ulcers. So we need to make sure that our patients are clean and dry after all incontinent episodes. So, my assistant, go ahead and take your hands up out of the water. Both hands, please. So, as you can see, the right hand there is significantly reddened, whereas the left hand is significantly not reddened. Here, I'll zoom in for a close-up. So, just slightly pink, but you can see that the water's beading up, kind of like when you wax your car, the water beads up. And then look at this. Oh, they're very pink. All right, can you flip your hand over for me? Oh, it's a little difficult with your range of motion. Well, ideally, had we left her fingers in there longer, then like I said, there would be that pruning on her fingertips. All right. Okay, so now station 2, you've come to You're Tearing Me Apart. So, as you know, poor little old people, they have this tissue paper thin skin. As you can see, we have this high quality piece of tissue paper here on the wall to represent our patient's skin. Okay, so what we're going to do is I'm going to have my lovely participant here go ahead and hop on up, or, well, please don't hop. Thank you. And then what I want you to do is I want you to waller around in the bed. Like our confused little patients that don't really know what's going on. They're hollering out to us. No, please don't actually holler out. Nobody's coming to help you. I'm really sorry about that. Okay, so as she's wallering around, oh, that didn't sound pleasant. Oh no. So, a lot of times when we reposition patients, it causes friction on their skin. Simple movements such as turning or lifting can create friction and shearing, which injures the skin. Okay, participant, you can stop wiggling if you would like. Thank you. So, as you can see in our paper here, it's ripped. It's torn. That's a problem. That happens with our patients all the time. So how can we avoid that shearing, that friction, that tearing effect? Well, we have many options. Draw sheets used in the appropriate way. Like having them run long ways on our patients as opposed to wide. That helps to prevent the heels from dragging on the bed. We also have the lift sheets, the green sheets that reduce that friction. We have the sheets that you can air up with air. There are lots of options. Additional options are making sure you have enough staff to help you. I know that sometimes that it presents a challenge, but when all possible, ensure that you're using those safe lifting techniques and you're getting enough assistance when you're moving patients. Also, another option is to raise the knees of the bed 10 to 20 degrees before you raise the head. Now, everybody knows I'm a real stickler about making sure that the patient's head of bed is 30 degrees. And we all know as soon as you do that, the patient slides down in the bed. So, if you raise their knees 10 to 20 degrees first, that helps prevent them from sliding down in the bed. So to prevent friction and shearing, use draw sheets and lifting devices to lift rather than drag patients. Keep the head of the bed 30 degrees as well as you can, or at the lowest degree of elevation consistent with the patient's medical condition to prevent sliding and shear injuries. Use cushioning devices such as pillows to prevent them from touching any bony prominences. Okay, so now we come to station 3. This station is You're Pushing Too Hard on Me. So what we're going to do is we're going to inflate this blood pressure cuff. So as this blood pressure cuff inflates, I want you to tell me what do you feel?
Pressure.
You feel pressure. Do you feel a lot of pressure?
No.
Okay. But it's enough that's there that you notice it, right?
Mm-hmm.
Okay. If you had your desires, you would have that knot on your arm, correct?
Correct.
Okay. So, how much pressure does it take to develop a pressure injury? A lot or a little bit?
I don't know. A little bit.
You probably don't know. But that's okay. Let me tell you. Even a little bit of pressure over an extended period of time can create a pressure injury. So, also, when that blood pressure cuff is inflating, how does your arm feel? Is it numb? Is it tingly?
It gets tingly.
It does get a little bit tingly? Okay, yeah. If it was left on for 5 more minutes, would you be uncomfortable?
Start to be, yes.
Yeah, okay. So, how uncomfortable would you be if we left that on puffed up for 2 hours?
I would feel like my arm was going to fall off.
Probably, So, how, as nurses and healthcare techs, how do we make sure that that pressure isn't extended? We have consistent turn schedules. What is our number one way of trying to have consistent turn schedules right now? It is turn teams. So when turn teams work, ideally, you have those 2 people that are going to go in there every 2 hours and turn that patient. So the problem lies is when people don't go into the room every 2 hours, or they forget their turn time, or they're running behind, but the group before them, were early. And so then you get this period of things, patients not getting turned every 2 hours. They're getting turned every 3 hours. If we left that blood pressure cuff turned up all the way for 3 hours, that would be miserable. Even 2 hours is uncomfortable. So we have to make sure that at bare minimum, we are getting into these rooms every 2 hours and getting patients turned. So now we come to station 4. In the last station, we looked at low pressure for an extended period of time. Now, in You're Squeezing Me, we're going to look at high pressure, intense pressure over a short amount of time. So, can you identify any high-risk areas for developing pressure ulcers in a short period of time that are experiencing high-intensity pressure? You probably can't, so I'll give you the answers. Elbows, knees, heels from laying in the bed. If we have a trauma patient who's got, a casted arm, they're not going to be able to move their elbow or their shoulder as freely because their arm hurts. So that's when we, put that arm up on pillows and alleviate that pressure. Same thing with their heels. We have the heel lift boots. Also, laying on medical equipment such as syringes or caps or wires in between turn times. That's when turn teams need to be performing quality turns to ensure that there aren't any of these issues that are going to happen. So my wonderful assistant here is going to demonstrate for us high pressure via a pin or a syringe or something on the patient's skin. And as that patient sits there longer and longer until we come into the room. And then the patient develops a wound because they've been sitting on this implement for over 2 hours. So the lesson takeaway here is tissue damage can occur within a short period of time with high intensity pressure. Actions that minimize pressure, such as using pillows and using wedges in between bony prominences, or even better, floating heels, will help to prevent those pressure injuries from occurring in the first place. As always, if you ever have any concerns about how to adequately offload pressure points, reach out to the wound team or your quality outcomes coordinator. All of those people would happily help you to identify problem areas and treat them before they become wounds. So now we come to station 5. So for this station, it's the princess and the pea. So hopefully we have a princess that is our assistant. So what we're going to do first we have a tennis ball and we have a pillow. And so we're going to put this tennis ball on the chair, followed by a pillow. And then if my princess could be so kind as to please take a seat. Oh, thank you. You're so dainty. Oh, dear heavens. All right. So, you're not supposed to, your face looks awesome. You're not supposed to wiggle around or anything, okay? So, we're going to see if you can feel that there's anything underneath that pillow. I'm going to read you a story of the princess and the pea, and then we'll assess and see how comfortable you are. So once upon a time, a girl wanted to marry a prince. Since only a true princess can marry the prince, his mother, the queen, tested the girl to see if this was the case. The girl had to sleep on top of a pile of mattresses. Unbeknownst to her, a pea was placed under the very bottom mattress. A true princess would detect this. Needless to say, the girl could not fall asleep because there was something making the mattress very uncomfortable. The pea. She told the queen of this, who realized that the girl truly was a princess. The girl married the prince and they lived happily ever after. The end. So now let's see if my wonderful assistant is a princess. Princess potential? Are you comfortable in that chair?
No.
Why are you uncomfortable?
There's something underneath me.
There is something underneath you. You can go ahead and take that out if you want. So, it's the same instance for us with our patients. We can't leave things underneath them. And also, the pillow itself was not the most high quality pillow. So what specialty equipment do we have that can reduce this pressure? Well, for patients that aren't ICU status, we have the P500 beds. They're low air loss. They help to relieve those pressure areas. For ICU status patients, we have the Progressa beds, which is literally the exact same mattress. It's a low air loss mattress. Other options are the Clinitron bed and or pillows. When we set patients up in chairs, make sure that there's a pillow underneath their bottom. Or, a pillow where there's any kind of pressure areas. The goal is to evenly distribute body weight as much as possible. So make sure that you use support surfaces on beds and chairs to reduce or relieve pressure. Ensure that they are in place and in proper working condition. So now we come to station 6. As you can guess, this station is all about nutrition. Nutrition is very important to our patients. Here you can see we have 3 different options for food. On our right and my lovely assistant's left, we have healthy choices. We have a banana, a wonderful garden ripened tomato, and a pepper. These signify healthy choices for our patients, comorbidities such as a cardiac diet for cardiac patients or a carb consistent diet for our diabetic patients. In the middle, we have, let's just say, less than healthy choices for food, such as a wonderful apple pie. We have some donuts that I'm sure are wonderful. And then on the left, and to my patient's right, we have no food at all. This signifies our NPO patients that nobody has remembered yet to get a dietary consult for. These patients, nutrition plays such a vital role in nourishing the body as a whole and the skin. Malnourished patients run a higher risk for HAPI development. Think of our patients that were found down in the home for an unknown amount of time. They've already got rhabdo setting in, and they need nutrition to help to nourish their body and allow their body to fix itself and also prevent more problems from happening. So the takeaway from this is to make sure to get that dietary consult for patients and help them make good food choices, or especially get some kind of a tube feed going for patients that are NPO, or a supplement for patients that have a poor dietary intake. So next we come to station 7. So the important part of station 7 is ensuring that everybody knows about the tools for pressure injury prevention. So as we stated in the very beginning of our slides, that there are many different implements that cause increased pressure. So pressure can be caused from a BiPAP or a CPAP. So how do we prevent pressure there? We make sure that the mask is padded. Optiflows can cause increased pressure along the ears, as well as nasal cannulas. So making sure that the nasal cannulas are padded, or that the strap on the Optiflow is padded along the ears. Ideally, those Optiflows are up along the crown of the head. C-collars. It's vitally important to ensure that padding is along any pressure areas on the C-collar, so the collarbone, the top of the spine, and the back. Other pressure injury causing things are NG tubes or Dobhoffs. So making sure that we're retaping them at least once a shift, or bridling them if it's going to stay in longer than 24 hours. ET tubes. This is a joint participation between RT and nursing to ensure that we're repositioning those ET tubes every 2 hours. Other things are the wonderful silicone dressings that we have. We place on the coccyx or on those elbows or on heels, anywhere where there's going to be that high pressure over a short amount of time, or that low pressure for an extended period of time. Additionally, making sure that we use the Mepilex AG or the gray one underneath trach flanges. Other options are the heel lift boots, which I fondly refer to as cheese boots. These go on patients' heels to make sure that there's no pressure on the heels whatsoever. Another option are our Sundance pillows here. These are fantastic because they're moldable and they help to relieve the pressure, equalize the pressure on the back of the patient's head. Remember that we talked about in the very beginning that the occipital area of the skull also is a high pressure area. So as we've established, now that we come to station 8, the last station, that it's vitally important for our patients to turn and to have quality turns performed. But I understand there are difficult patients. Let me introduce you to this one right here. Some patients, no matter what you tell them, they don't want to turn. So we walk into the room. Hello, Miss Bruns. I am Jess. I'm with your turn team for this hour. Your turn is a critical part of your care. Turns are necessary to ensure we keep your skin healthy. When you don't turn, you're at risk for tissue death and could cause serious health conditions that will lead to frequent follow-up visits post-discharge. So, are you ready to turn?
No.
No, but this is part of your plan of care. As your nurse and the tech that's with me, we are here to make sure that you are receiving the best quality care while you're here.
No, I don't want to.
Well, if you're not turned correctly, tissue death and skin breakdown can easily occur within 2 hours. That's why somebody from the turn team is back every 2 hours. So, do you want to turn now?
No, it hurts when I do that.
That's understandable. I understand that it's uncomfortable sometimes to turn, but honestly, it really is a little bit of pain to prevent you from having a lot of pain. Pressure injuries are very painful, and it increases your risk of a life-threatening infection throughout your body. So now do you want to turn?
No, I don't.
No. But pressure injuries have the potential to increase your length of stay in the hospital, and it creates costly treatments. Also, it may run the potential of you not being able to go home at all. You may have to go to an extended care facility or maybe even a nursing home. Do you want to turn now?
Oh, yeah. Make it turn.
All right, we'll get started on that turn. So the takeaway from this is to make sure that when patients refuse, we're doing everything we can to educate them so they understand the risks and benefits of turning. Reinforce that somebody will be back in 2 hours for another turn. If your patient continues to really not want to be turned, make sure that you're escalating that to the UNL or to the primary nurse if you're not the primary nurse. The UNL will also then go in and try and talk to the patient and the family into allowing us to turn them. If the patient still refuses the turn after talking to the UNL, unit leadership needs to be notified so they can have a conversation with that patient.